Hello and welcome to the Alabama Public Health Training Network. I'm Claire Lenker, Associate Professor of Pediatrics at the Pediatric Pulmonary Center at UAB. Thank you for joining us today for our program, Children's Environmental Health, More Than Smoke and Mold. This program is supported in part by the UAB Pediatric Pulmonary Center grant from the Health Resources and Services Administration, or HRSA, of the U.S. Department of Health and Human Services. The contents of the contents are those of the authors and not necessarily represent the office or endorsement by HRSA, HHS, or the U.S. government. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handout, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be available for 1 year for nurses, expiring on June 30th, 2020, and 2 years for social workers, expiring on June 30th, 2021. If you are watching this program on demand and want to receive a Social Work CE certificate, you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you are watching this program live, there is no social work test required. For social workers, if you are watching this program live, it qualifies for classroom hours. If you are watching on demand, it is considered non-classroom hours. Before we get started, I would like to introduce our faculty presenter today. Dr. Ann Turner Henson is a retired professor from the UAB School of Nursing. Welcome.
Thank you, Claire. It's great to be here. I'm pleased to present on children's exposures. The quote by Frederick Douglass is a key theme in my work, where I've worked with communities, children, and families in promoting healthy environment. Frederick Douglass once said, "It is easier to build strong children than repair broken men." And that's been a key theme in my work as a pediatric nurse. We're really wanting to have healthy children. So if we start when they're children, hopefully they'll become productive adults and healthy. In today's presentation, I'm going to discuss the uniqueness of children and the risk associated with exposures to environmental toxicants. In the objectives for the presentation today, we're going to be looking at the unique vulnerabilities of early life exposures, how these vulnerabilities predispose children to later life disease, and using selected environmental exposures, we'll be examining issues relevant to children, examining the science behind these exposures, and identifying actionable messages that you can use in clinical practice, and finally assisting you as a practitioner, be it a nurse, a social worker, a physician, a nutritionist, PT, OT, or a public health professional, or if we have anybody from preschool or schools, in developing your own toolkit that you can use in clinical or in your practice. In the past, most of our childhood mortality and morbidity was primarily due to infectious or acute conditions. As research has made vast improvements through the use of vaccines, medications, and other advances, many of these acute infections are no longer threats to children. So therefore, as a result of environmental exposures, children in the U.S. are at higher risk for chronic disease, and many of these chronic diseases we see in later life. These risks are seen with the increasing risk rates of cancer, particularly leukemia, as well as asthma and autism. Environmental exposures are now linked to conditions such as prematurity, lead poisoning, respiratory conditions both acute and chronic, and autism. We now know through research that environmental exposures have a greater impact on children's lives. Much of this recent research, particularly the research related to prematurity, lead poisoning, and autism, came from the EPA Children's Environmental Health Research Centers. And one of these centers is actually located at Duke and another one at Emory, doing very important work. However, from an advocacy standpoint, these centers are currently under threat for funding. So as an advocate, I encourage everyone to write for this funding to continue, because it's very important work that's being done at the centers. Children's environmental health has had significant impacts on society. Vulnerabilities such as asthma, cancer, IQ, autism, and chronic disease results in many economic burdens. Consider annually over $76.6 billion are spent on environmentally related diseases in the United States. David Barker, who was an epidemiologist in the United Kingdom, and his colleagues did some epidemiological studies in which they looked at coronary heart disease among adults. Through their research, they found that birth weight was inversely related to early death secondary to coronary heart disease. Through these studies, Barker and his colleagues led to an understanding of the origin of the complex adult disease, or the epigenetics. The Barker hypothesis, which is a hypothesis that has led my research in environmental work, proposes that adaptations to the prenatal and postnatal environment establishes a pattern of interactions between genes which control a variety of cellular and organ functions. While individuals may survive the prenatal and postnatal life, these interactions have adverse consequences in adult life. Thus, the adaptations made in utero to the hostile prenatal environment, that is, the environmental exposures that they have, may place the infant at risk for later life adult onset diseases. So you can see in this slide, I took a Time magazine where it talks about Barker's hypothesis and how these early life exposures has led to prematurity, asthma, obesity, and then the whole host of adult diseases as well as aging. Further studies by Barker and colleagues, as well as others, have found that the first 1,000 days of life are highly predictive of later life wellness and disease. So if you are working with preschool children, and I particularly am focusing now on those that work in child care, you are critical in providing a healthy environment for children. And I am very passionate about this. Prior to retiring, I served as the health consultant for JCCEO Head Start and Early Head Start, and I would always tell the teachers, you're critical because you're working with children during the first 1,000 days of their life, and you can work to provide a healthy environment. Thus, we get back to why is environmental exposures so important for children, and you can see I'm highly passionate still about that even in retirement. Another concept is the social determinants of health. We know that there is a range of personal, social, economic, and environmental factors that are known to impact health. These are referred to as the determinants of health or the social determinants of health. I selected the World Health Organization, also known as the WHO, for their conceptual model on the social determinants. There's lots of them out there. I just picked one as an example. So as we go through today's presentation, I want you to think about these social determinants and how they interact with environmental exposures. Payne, Sturgis, and G published a paper in 2006 in which they linked these social determinants to environmental exposures. I added in red to their model the red print for living and playing environments of children and learning environments of children. So as we think about environmental exposures for children, if you look on the right-hand side of the screen, you will see the things such as sources, concentrations, and physical route of exposure. At the child level, we really need to think about the internal dose that they're taking in, how it's biologically impacting the child, and the health effect. And we'll be talking about that as we go through today. So today, as we consider children's unique vulnerabilities, we need to look at where they live, learn, and play. And for those that, I also like to add in the spiritual part, so I say pray too, because for many in the South, the church environment is also an important thing. And if any of you work with churches, I also like to think about churches in terms of those preschool classrooms. That's another little tidbit to think about. Another perspective that came from the American Academy of Pediatrics is to think about children's vulnerabilities in terms of the physiologic, behavioral, and biological factors in children. So if we think about the physiological factors, children have a much higher metabolism, which leads to an increased consumption. They may disproportionately have heavier exposures to toxins in water, food, and in the air. From a behavioral perspective, we know when they're little ones, they always want to put everything in their mouth. So the hand-to-mouth behavior increases ingestion of toxic chemicals in the dust or the soil or crawling on the floor. Playing close to the ground increases their exposures to toxins in the dust, soil, carpets, and low-lying layers of the air. And from a biological perspective, we know that children and even adolescents may have do have immature metabolic pathways. They're less likely able to detoxify and excrete certain toxins. Their organ systems are still developing. We know brain growth doesn't stop until you're 6 years of age. And it allows for future years of life for the development of chronic diseases caused by these early environmental exposures. The other thing we need to think about in terms of these exposures is many times these exposures can be cumulative or they may even be micro-exposures. And even micro-exposures can create problems. So we're going to look at, again, specific selected exposures. When Claire asked me to do this, it was like opening my whole toy box. And I had a hard time just picking a few of these. And so I'm not going to cover the whole gamut of environmental exposures, but I tried to pick a couple that are crucial for us to think about. So know that I couldn't include everything. So we're going to look at indoor air quality, tobacco, including secondhand smoke exposure, lead, radon, pesticides, household chemicals, outdoor air, and climate change. So now let's think about children's unique vulnerabilities. This presentation is not just relevant to those that are concerned about children, but we also need to think about the reproductive period and the pregnancy time. So let's look at this from a developmental perspective. We know that the epigenome is inheritable and highly vulnerable to toxicants during periods of rapid growth, such as development and growth of that fetus. We know that toxicants or these chemical exposures can have an impact on DNA, particularly DNA methylation in children is associated with exposures to toxicants such as your lead, your polycystic aromatic hydrocarbons, or your PAHs, such as that found in cigarette smoke and motor vehicle exhaust. We also know that the ovum, or the oocyte, and the sperm are highly vulnerable to many of these toxicants, so we have to think about our young adolescents in terms of what they're exposed to. And in terms of, I always like to think about lead. Lead is one of the things we need to think about in terms of maternal bone accumulations, but how that mother or that young female may be at risk for accumulating the toxicants. And of course, the fetal development, organ development is very rapid during the first 3 to 8 weeks of gestation, many times when women don't know that they're pregnant. We also have to think about neural development, and many of these toxicants will cross the placental barrier. What about the newborn? We know that many toxicants can pass through breast milk, and even the water used in formula can pass many of these chemicals to babies. So think about pesticides and lead, or even household chemicals. Dermal exposure is another route for young babies. Organ development is rapidly changing in infants as they grow. Their body fat, they may accumulate a lot of these toxicants in their body fat, and they have a much higher rate of metabolism. Infants and toddlers, they love to explore. They have everything in their mouth. And also you're starting to introduce solid foods, so you have to think about where's that food coming from. We worry about apples with the amount of arsenic that we see in apples. Infants and toddlers have higher rates of respiratory and metabolic rates. They increase consumption of oxygen, so they're taking in a lot, crawling on the floor and picking up the chemicals off the floor. Daddy comes home from work. He's got those chemicals from outside on his feet. The preschool and the school age, they require more calories for growth, but they're spending more time away from home. So they're out of the eyes of their parents and may have exposure. The group most people forget about in terms of environmental exposures are the adolescents. And I think this is a critical group to consider. They have freedom from parental supervision. Pubertal development is so key. We really need to think about protecting their reproductive abilities in terms of the environmental exposures. Risk-taking behaviors, oh my goodness, I don't know how I survived it as a parent of 3, or even my own adolescence period of, think about it today with the e-cigarettes and all those toxicants out there, and I especially worry about e-cigarettes now. I know that they're working with the Juul company to change that thing that looks like a USB drive, but just the exposures that they may have. And then one thing that I really want to hit home on that we'll talk more about are the occupational exposures. One of my twins worked in auto mechanics, and I was always worried about the exposures he had in trade school. And so we'll talk about that. I'll have some things for your resource toolkit on that area. High-risk populations. My work is, and as well as Claire's work, has always been with children with special health care needs. Think about it from a mobility perspective, but also in terms of the exposures they may get that are unique because of their health condition that may predispose them to things. Children in poverty, those that are primarily ethnic minorities, may because of some of their ethnic practices, parents who are farm or migrant workers, or living with a parent who has a mental health condition or a substance abuser. I really worry about the children who may have an early exposure to meth because of things that the parents bring home. So let's start looking at some of the toxicants. And as we look at the toxicants, I'm going to talk kind of globally a little bit about the toxicant and then link it to the children's vulnerabilities. We know from research, and I am a nurse scientist, that indoor air toxicants can be more concentrated than outdoor air toxicants. Asthma is strongly linked, and we know through tons and tons of research, is strongly linked from indoor air exposures. Formaldehyde is something people don't think about. And one of my former doctoral students, Dr. Azita Amiri, who is now at UAH in Huntsville, in her dissertation work, she found that formaldehyde exposure in pregnancy, particularly during the second trimester, was associated with decreases in fetal growth. And if you want to see more of her work, she has it published. We also know that pressed wood, new furniture, off-gases. We have a lot of off-gassing of other things in our homes. And another place for formaldehyde exposure for us ladies to think about are nail salons. And nail salon workers have a high exposure to formaldehyde, so you have to think about the ventilation of those places. And there's been some research that's shown an increase in infertility, spontaneous abortions, and premature birth from exposure to formaldehyde. So think about that when you go to the nail salon. How well is it ventilated? While there are no regulations for while there are regulations for your air in your workplace, there are no regulations for the air in schools, which the school is a child's workplace. So think about that in terms of indoor air. Children spend about 80 to 90% of their time indoors. We know that the breathing zones, as we've talked about before, place them at lower rates, lower levels to the floor where chemicals may be concentrated. And research has shown that exposures associated with respiratory symptoms, particularly asthma exacerbations, are linked to indoor air. So I have a picture here of a home, and so if you can think of where you may be exposed to indoor air pollutants, it could be in the living room, it could be in the kitchen, bedroom, bathroom, in a study or the attic. And I actually did some work many years ago with a team of investigators across the U.S. where we measured dust allergens in the schools. And it was interesting that we found the highest concentrations of cockroach allergens in first grade classrooms and in the library. Surprisingly, we found cat allergen in the school. And that's because cat allergen is sticky and it sticks to your clothes. And so I have an allergy to cats. And so think about that as an indoor exposure risk. And that work is published if you're interested. Now, of course, as Claire knows, I've done a lot of work in tobacco, so I had to include this. But a new risk for us today are electronic cigarettes. There's been some work done looking at the actual liquid in electronic cigarettes. I know it is now being regulated better, but you have to worry about that as a potential harmful toxicant to children many times because people will refill it, and it's highly poisonous in terms of the amount of nicotine. What's very concerning is the rate of e-cigarette use among adolescents, and it is skyrocketing. The CDC estimates from the National Youth Tobacco Survey, done the 2018 one, that e-cigarette use or vaping among middle school and high school students increased alarmingly between 2017 and 2018, with over 3.6 million children using e-cigarettes. A big, big concern. My previous research has been in secondhand smoke exposure. One of the things we need to think, I have a listing of all the risk of secondhand smoke or third-hand smoke exposure. Secondhand smoke is when the person's actually smoking in the room with you. You can get third-hand smoke exposure, which is the residual smoke left in the room. I want to mention an area of concern for us in terms of smoking. We often think about no smoking rules in your home. Well, you need to think about no smoking rules in the car. And Semple et al. In 2012 published a study where it looked at peak PM 2.5, and the PM 2.5 is the small particles of the particulate matter, and found alarmingly very high rates of PM 2.5 in cars after just riding a couple blocks with smoking with the windows open. So again, the third-hand smoke exposure in cars is very, very high. This looks at where secondhand smoke can go in terms of just not only your homes, but this actually shows a graphic of how it can go through a apartment complex, so that you can have a smoke-free apartment, but your neighbors smoke, and how you can get exposure. In New York, they have some smoking restrictions, and I think HUD passed some in public housing, which is helping in that area. A little bit on lead. I know that the lead group here at ADPH is going to do something on lead, so I'm not going to spend a lot of time. We now know that no lead level is considered safe. And this is based on the CDC standards. There's a listing there of what are some of the major sources of lead. They are using a reference level of 5 micrograms per deciliter, to identify children with lead levels. But now the shift is to primary prevention in terms of lead. Here are the risks for lead, and I really want to point out Again, adolescence, in terms of the storing of the lead in our females and their bones, is a major concern. We know that prenatal lead exposure has led to adverse effects on maternal health and infant outcomes. And the CDC and the OB/GYN group is not recommending at this time that I know of lead testing in pregnant women. I hope that will change. Is that true? That's true? They're not testing in? As far as I know right now, yes. Okay, thanks. We have a lead expert here. The rates of lead levels in Alabama are low, but you have to think about, is everybody being tested? Special populations are to think about your immigrants, your foreign-born adoptees, refugees. If the parent works in a lead-type environment where they may be exposed. I want to show this slide here because this is Bruce Lamper's work from 2005, and I want you to think a little bit about Flint, Michigan and what's going on there. Some of the levels in Flint, most of the children in Flint had levels less than 10. What this slide shows is you find the greatest decrement or the greatest decreases in IQ for levels of lead less than 10. And that's a big concern. There has been some work by Gold in 2009 who found the beneficial cost savings for lead hazard control were estimated to be $192 to $270 billion related to the social, economic, and health benefits. Because we know when you have just a small shift in your IQ, it can lead to learning disabilities, it can lead to behavioral problems. So if we can do more primary prevention, and I'll talk later on about that. Radon. Radon is a chemical, is a substance that enters homes through the cracks or openings in walls, foundations, and floors. It's the second most common cause of lung cancer in the state, and the red areas in our state are the greatest areas of concern. Mold and moisture. Mold and moisture is water leaks leading to mold overgrowth. Of course, we've had some tornadoes in our state, so we've had some floods, hurricanes where we have a lot of problems, rental homes. Mold is the most common trigger for asthma and respiratory symptoms such as allergic rhinitis, irritations of the eyes, nose, and throat. Later on, when we talk about actionable messaging, I'm going to talk about cleanup, but I want you to pay particular attention to that as we enter the next hurricane season. Pesticides. Pesticides are chemicals used to control insect, weed, mold, and rodent problems. One of the things we have to think about is pesticide use in the home. We have to think about parental, adolescent, occupational exposures, such as through agriculture or industry. There are some pesticides that have been removed from the market, but they often linger in the physical environment in our areas. In terms of children's risk, children are very vulnerable to pesticides as well as during pregnancy. Their risks are because of the higher metabolism, their immune system, hand-to-mouth, diets, etc. Cohort studies have reported inverse associations between the microbial exposures in asthma, wheeze, and atopy. We've seen that a lot of children living in rural and farm communities are exposed to a lot of these pesticides, either as take-home from the parents or because of where they live. I'm going to do a little, I was going to save most of my intervention things for the end, but this is one message I want everybody to take home right now. Children under the age of 16 should never, never, never apply pesticides. Children under the age of 16 should never, ever apply pesticides. And as Claire reminded me, I don't even know I want them fueling up the car because of where they are in terms of that vapor from the fumes. So you have to think not only from a developmental perspective in terms of the physiological thing, but also anybody under 16 doesn't have the common sense yet in terms of applying it. Now, I know over 16, many of us don't still get that common sense, but I'm worried about their reproductive life. Household chemicals, one of my favorite things to talk about. So if you think about the cleaning products, the plastic and vinyl products, the other thing to think about, ladies, is our personal care products, our cosmetics, our things that we may even clean our skin, our nail polishes we use, new furniture in terms of wood, solvents, and then I'm not going to try to say all those names of those chemical things because I tend to slaughter them, but our pylates, our BPA, formaldehyde, VOCs, and POPs, or your persistent organic compounds. One of the issues we see in terms of health effects from household chemicals are your allergic reactions, nausea, respiratory symptoms, but one of the things, a take-home point for y'all, are those long-term effects are often not known. So I always like for people now to kind of stop and envision not only what you're telling your clients, but what's in underneath your cabinet at home. And I always like to say, if you're using a cleaning material in your home and the inside of your nose tingles a little bit, and I use this when I talk to people, and I always just kind of, I know I may over-exaggerate this a little bit, but I say, if you're using that product in your home and the inside of your nose is tingling a little bit, you're killing off cilia in your respiratory tract. So think about using something less toxic, like vinegar and water, which we'll talk about later on. Outdoor air. Particulate matter is that the dust or whatever that comes up in the outdoor air, and ozone. There's two types of particulate matter we need to think about. The PM10, which is the larger particle that can enter and be deposited in the respiratory system. And then your PM 2.5, which also can be deposited in the respiratory system, but can affect your respiratory and cardiovascular systems, the smaller areas. So where do we see issues in terms of outdoor air? It has been linked, outdoor air pollution has been linked with post-neonatal mortality and long-term problems, of course, asthma and respiratory conditions, lung growth and function. Gatterman and his colleagues in California studied where children lived and went to school in proximity to interstates and industry. And they found children that lived in closer proximity or went to school in closer proximity to interstates had decreased lung growth and decreased lung function. The other thing is some of my research now is looking at the natural history of the development of hypertension, and we're studying this in children. Other research, such as studies that were conducted in Mexico City, linked air pollution to increase blood pressure in children. So you not only see from the outdoor air pollution a impact on the respiratory system, but also on the cardiovascular system. I love this slide. I use it a lot. This links in the, if you can see it in the red there, the first column of numbers shows the ozone less than 60. This is data taken from when the Olympics were in Atlanta. And if you know Atlanta, it has 285 around the outside, 75, 85, 20 in the middle. Well, if you can remember back to the Olympics, and many of you out there were probably too young to remember this, but when the Olympics were going on in Atlanta, they literally shut down 20 through the middle and 75, 85. So outdoor air pollution dropped precipitately in Atlanta. And they saw a decrease in Medicaid claims, HMO claims, pediatric emergency room visits, just from closing the interstates. And there's some other data too that's very interesting to look at. So you can see when you clean up your air, what happens. And think about even the Olympics that we had in China, where the athletes had so much trouble. I can't talk about environmental exposures without talking about climate change. Yes, I know this is a highly politicized issue, but come on, folks. I'm a scientist. Climate change is real. Climate change are the major physical, chemical, and ecological changes. We're seeing changes in temperature, precipitation patterns, sea level, and extreme weather events. Many of us in this state lived through the big hurricane last year, so you saw climate change. And in 2011, all of us in this state, and it's very sad to think about the 250 people that died from the tornado outbreak. That is climate change. So how does climate change impact children? Increased heat stress, air quality. We're seeing infections come back in terms of some of our climate-sensitive infections, and food insecurity. But the other thing about climate change is that climate change impacts our indoor environments even more. So if you think back to the mold and the moisture, you think back to we're using more of those chemicals because of the rodents coming inside, the pests coming inside. So climate has a big impact. And the Institute of Medicine actually released a report several years ago of the impact of climate change on indoor environments. Children are more likely to suffer from weather extremes. Low-income, minority, inner-city, and rural communities may suffer disproportionate harm from climate change. The large recent man-made disasters has also resulted in environmental consequences. And I'm thinking in terms of our native flora and fauna, as well as when we had the Gulf oil problems, the oil spill a long time ago. So now we get to the fun part. Let's think about how we can get these messages out there. Now, I'm a pediatric nurse. I have a PhD, so I'm a nurse scientist. I don't have a background in communication, which some of you out there probably have better backgrounds in that than I do. But I want you to start to think outside the box. You don't need to do everything. So if you're the health provider, you don't need to deliver all these messages. I worked on Bright Futures, which is a well-child prevention guidance put out by the American Academy of Pediatrics and MCHB. And when I was working on this, I have to tell the little story of my chat with Joe Hagan, who was the editor. Because I kept wanting Joe to put more environmental health stuff in Bright Futures. And Joe said, Ann, pediatricians don't have time to do everything. And I said to Joe, you pediatricians don't have to deliver all these messages. You've got help out there. Okay, nurses, social workers, pediatricians listening, public health practitioners listening. We don't have to do everything, okay? Use other avenues for messages. But if you are going to deliver some of your messages, here's some things that Maida Galvez in her article talked about. Frame your messages in a positive sense. Craft them in lay language, kind of like my nose thing when I talked about the cilia dying. Think about your delivery methods, and I really think we in healthcare, we need to get those communication people coming over and helping us learn how to use those systems, like text messaging, YouTube videos, because our millennials, what? They want things short, okay? They're not going to sit down and listen to an hour talk. And what's so important is to work together with our community and public health partners. I had an EPA grant a couple years ago where I trained community health advisors, lay people, how to deliver these messages. And I trained those ladies almost 20 years ago on some of these concepts. And they're still doing it today. Now, they're not doing it as big organized fashion, but they're still talking about what's cool about vinegar and water to clean your house. Okay? So use your partners. This is from the American Academy of Pediatrics, as well as the NEEF, the National Education Environmental Group. For a priority environmental health history, I encourage you to put this in your health histories if you can. Janet Johnston and I, years ago, along with Raymond Lyrene, some of you may remember Janet and Raymond, We were able to get Children's Hospital to add, does anybody smoke in the home or in the car, to their health assessment on every visit. Peeling paint, what type of heating system do you have? What's your water source? Is there water damage? Mold, chemicals, pesticides, what do they use? You can use an extensive history. Bright Futures encourages people to get health history in a variety of ways, but you can go to the resource there on the link there and get more. It goes into sun, tanning salons. I'd probably even ask if they go to nail salons, fish consumption, testing your house for radon. Are we testing our schools for radon and our preschool environments for radon? Noise, and the occupations of the adults and the adolescents. So you pediatric providers out there, are you asking where the adolescents are working or where they're going to trade school? So for each of the toxicants that we talked about, I have a couple messages that you can use. How do you ventilate the home? Are you changing your filters as prescribed monthly, or how your system says you should change them? What's your indoor humidity set at? If you wake up in the morning and the inside of your windows are wet, your humidity is not set correctly. And are you reducing the use of products that release air pollutants? So everybody think now, what's underneath your sink at home or where you keep your cleaning supplies? So y'all out there, if you've got Lysol or Pine Sol spray or plug-it-ins, the next time your community has a toxic waste day, let's take it down there and don't buy them anymore. I'll give you a tip. This is an environmentally safe tip. So if you want to have your indoor air smelling better, get some vanilla and a Q-tip. Dip the Q-tip in the vanilla and sprinkle it on top of your light bulb, and when you turn your light bulb on, it smells like you're baking bread. Get rid of those aerosol sprays and those plug-it-ins. They put harmful chemicals into the air. Tobacco smoke exposure. We should be inquiring at every healthcare visit, be it outpatient, inpatient, ED. Are they smoking in the home or are they smoking in the car? Wherever the child is going. And then offering resources. One thing that Janet was able to accomplish, and Joy O'Brien, I have to also credit Joy for that, is getting Children's Hospital in Birmingham to stock nicotine replacement therapies so that we could send parents down to buy them. Have no smoking rules in the homes or cars. I did a study many, many years ago I was the PI on the study. It was funded by the CDC, and it was with Connie Kohler and Ronnie Grad and Nalini Satyakumar and others, and we developed an intervention where we taught 4-year-olds how to talk to their parents about not smoking in the home and the car, and it worked. They said please or thank you, and we were able to significantly reduce their cotinine in their urine. So it was biologically a way to reduce tobacco smoke exposure. Radon. Know what the risks are in your community. You may be living in a county where the risks are very low. Home testing. So if you live in one of those red ones from the thing, you should be testing. And then think about your school buildings, particularly in those areas, and your preschool, early childhood environments. And new home construction in terms of remediation or retrofitting. Lead. I'm not going to go over when the lead screening should be done. They'll be talking about that. But one of the things I want to say about lead screening is that all children should be screened for lead, not just those that are low income, but everybody. Baby formula preparation. If you're concerned about lead in your solder, I live in a home that was built in the 1950s. So what I did every morning was I got up and turned my tap water on for about 30 seconds and let my water be flushed. Washing your hands, removing your shoes before entering the home, wet mopping and dusting. And whenever you cook, tell your parents to use cold water to prepare their food. Don't turn the hot water on. Let it heat up, because you don't want that lead seeping out from the solder. And there's a whole ton more that I'm sure she'll cover in a couple weeks. Is it a couple weeks, I guess?
We've actually got to July and August.
July and August. Okay, thank you. Other thing is contact in terms of lead if there's peeling paint present, and then the home remediation and the risk for pregnant women and children. Mold and moisture. Well, you can't get rid of mold unless you fix the water. And if you have a water leak in your house and your wood on your windows feels mushy, you can't get rid of it. You've got to take that wood out, because you're never going to get rid of all that mold. Another key point, how do you get rid of mold? Scrub with soap and water. Don't use bleach, because you're going to get that chlorine, which is very, very toxic. And ventilate when you're getting rid of the mold. The guidelines say if you have mold that's greater than 10 square feet, you really should get a certified contractor to help you with that. And there's a lot of guidance on the EPA website on mold. Pesticides. Okay, I didn't put it on here on red. I wish I did. But remember that message I told you all a little bit ago? Children under 16 should never, 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 never use pesticides. Either apply them, work with them, etc. We need to use less toxic ways to get rid of the critters in our house. And I don't mean the kitties and the cats. Or the doggies. I mean those little things that crawl around, like the cockroaches and the ants. Using baits, traps, or gels. Washing or rinsing off our fruits and vegetables, thinking where you store things, and using integrated pest management in both your homes and your schools. I could talk for hours on that, but I just refer you to the websites for that. Household chemicals. I had to put some red in here. Never remove the labels from your household chemicals or your pesticides. Keep them in their original containers. Do not mix products. I sound like I'm preaching and yelling at you now, I know, but the reason for that. We had a young woman who died in Birmingham because she mixed ammonia and bleach, and the fumes killed her. My favorite thing to clean with, and you can go to my house and check under my cabinets, is dilute bleach, and then I open up my windows if I need it. But on all my floors, kitchen floors, bathroom floors, wood floors, tile floors, yada, 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 I use dilute vinegar and water. You will not find in my house any plug-ins, plug-it-ins. You will not find any Lysol spray, Pine Sol spray, Fabulosa. I know I'm doing trade names. You're not going to find ammonia in my house, okay? Use less toxic cleaning things. I have big jugs of vinegar, and that's what I use, okay? It's great when my little doggie has an accident. A little bit of dilute vinegar and water on the floor works just as well. Store things out of reach, and also have the National Poison Control number plastered on your phone. And when I worked with Head Start, we had this on every phone. So in preschool environments, it should be there. In terms of outdoor air, on my phone, I get the outdoor air quality every day, so I know what color it is. At Head Start, they actually had a flag. They didn't actually have a flag. They had a red light, green light. So depending on what the air quality is, they might have changed what they did. There's a flag program that you can get through the EPA for schools. So if it's an action day, cleaner commute, car maintenance, and special precautions for those action days should be for not only the schools, but when the children play outside and when band practices and football practices. I know that's not very popular among coaches, but we want them to be safe outside. Conserving electricity, environmentally safe products, climate change in terms of energy use. I'm going to spend a little bit of time talking about your clinical practice environments, only because this is an emerging area. I really encourage everyone to go to the Healthcare Without Harm site. They have a ton of stuff for institutional settings such as hospitals or clinics or public health departments. We as nurses particularly are exposed to chemical soups of toxicants, be it the chemicals in the environment where we practice, be it the infectious agents, or even the medications we use. And the hazards may be present in terms of neurotoxins or carcinogens or a whole host of things. In terms of the clinical practice environment, we need to think about using green cleaning to the most that we can, using products that pose the least risk to human health, using alternative products that don't have mercury in them, getting rid of the BPA. With healthcare-associated infections, there is some concern about some of the chemicals that are in our disinfectants, but using them in a safer way. The other thing about healthcare environments is the waste minimization, thinking about recycling, recovering, source reduction, and segregation in terms of waste. So there's a whole host of things in that, and that may be something that y'all may want to get someone to come and speak later on. So let's build your toolkit. Now, environmental health is my passion, but I see myself, so many of you may think, well, Ann's an environmentalist. No, I don't consider myself an environmentalist. I consider myself a pediatric nurse working in public health who has a passion about environmental health and, again, wanting to build stronger children, okay? So there are a ton of resources out there from, I want to highlight a couple. From the Alabama Cooperative Extension Service, they have a lot of great resources, and also Healthy Homes Training, which is a great thing through HUD. We don't have an active Healthy Homes system here in place in Alabama, but on your resource sheet that I have posted, there's a handout. There are some links there for that. So the Extension Service is a great resource because they can come out and talk to public groups or provide you resources. Of course, the EPA and the CDC have a ton of things. Now, because of some political actions recently, some of the things on the EPA's website have changed, but I noticed that they're adding more of the climate change stuff back in, which is good. I want to applaud the Alabama Department of Public Health. You kept up one of my favorite worksheets, the one on diet and lead, which is a great thing, and I'm going to talk to her about having her highlight. But remember when we talked about the lead levels less than 10? They've got a great handout on there about encouraging a diet that's high in protein, high in calcium, low in fat, for those lead levels less than 10. And I have some suggestions for preschool settings, Head Starts, and the lead group in terms of that, and I'll work with them, with public health on that. Eco-friendly child care, which comes from the Children's Environmental Health Network. They did a training here a couple years ago. If you want more information on that, I put it as a link there too. Another great resource that I just found out about a couple days ago, comes from the School of Medicine at Mount Sinai. If you are in a clinical setting where you're wanting some nice handouts, they have a prescriptions for prevention, and that's on the second page. Another thing to highlight is adolescents. And I'm going to skip over the home and school settings because there's a ton of things. But let's talk about the adolescent worker. I highlighted on here OSHA has a thing if you have an adolescent who's working in terms of their worker rights and the risk for them in the environment. So like let's say my son is an auto mechanic. And so let's say you have an adolescent that's going to trade school. What should you be telling that adolescent client? Well, they should leave their work clothes at work or bring them home in another bag, and they should be wearing those nice blue gloves when they're working on it, and they should know when to wear the eye protection and the respiratory protection. So I just wanted to highlight a few of those things. But this, I did check all of the links that I posted on the 5 pages of the handout. I put a few things on here for healthcare without harm. So I think now time for questions if we have a few.
We don't have any questions on the email, and I don't think we've had any calling questions. Do we have any questions from our audience members?
I actually do have a question. So I was just curious, in the research that you've seen on lead poisoning, when you look at the long-term effects, particularly the behavioral and the cognitive effects from early childhood, if there is any weight given between cumulative lead exposure versus a short-term high lead exposure.
I think we're going to learn a lot about that from the Flint, Michigan episode, unfortunately. I can't speak to that exactly. I don't remember all those studies. I've never done research in lead.
Okay.
Most of my research has been in tobacco and blood pressure. But I know that, so I don't know the answer in terms of short-term versus cumulative. I worry, though, in terms of the female storing it in her bones for later life. So does that help your answer?
That does, yes.
Okay. And I'll try to look at the literature for you before you do yours.
Okay.
But I think one of the things we need to realize about both lead and tobacco smoke and any of these toxicants, that no level is safe. Mm-hmm. I served on the EPA's Children's Health Protection Advisory Committee at the federal level, and there's a lot of concern about nanochemicals, about the impregnating of disinfectants in some of our appliances. And that's why those children's environmental health research centers are so important, because they're potentially could answer a lot of those questions. And that's why the funding for that is so important. Okay. But I think for now we need to operate that no level is safe for children.
Mm-hmm. Right.
Okay.
Thank you for that question.
Any other audience questions? I have a question about candles and essential oils. You know, all the rage right now in home decor, and what can you tell us about materials that might be in candles, specifically that come from outside the U.S. manufacturer?
I don't use candles in my home, and one of the reasons I don't is I have asthma, and so I like a non-fragrance home. Fragrances bother me. But a lot of times candles made outside this country have a lead wick in them, so they're actually burning lead into the air. You also have to think about coffee cups. I'll never forget Whitland Battle. I was working with her a long time ago, and somebody was giving out coffee cups, and Whitland said, well, let me test it for lead. And the coffee cup was coated with a lead porcelain. So you have to think about, if you serve a child something in that coffee cup, the lead could leach out. So.
Okay. All right. Do we have any other questions for our speaker? We haven't had anything come in on the email.
Well, let me say a little bit about Roundup.
Go ahead.
Okay. So you're hearing a lot on the news about Roundup. Roundup is a very toxic chemical. The EPA has not pulled Roundup yet. There's been a lot of the chemical in Roundup, and I'm not going to say the name of it because I slaughter it when I speak it, but it has been associated with cellular dysfunction. Roundup hasn't been pulled for the market, but I would urge caution if you're using Roundup, that if you're going to spray it in the evening when the children are not outside, and have children wash their hands, their feet, and their clothing when they come inside from playing outside, and take a bath before they go to bed. The case on Roundup is still not known, but thank you.
Okay. Okay. We have a few more minutes. If we have any other questions, or if our speaker has any other content that you'd like to share with us.
I just want to say that the more we know about the environment, that it's not just a fad. It's out there, and we all need to do what we can to protect our environment. Climate change is real. And I want to say that quote again from Frederick Douglass. It is much easier to build strong children than to repair broken men. That's been the premise of my work as a pediatric nurse for many, many years. And I think every pediatric provider should be concerned with environmental toxicants and do their best to reduce children's exposure. Thank you for this opportunity.
Okay. This concludes our program for today. I want to thank Anne for being here, and thank you for watching. Have a great day.